Mhm. My screen is visible, this image.
Yes, yes, yes.
Okay. What are the eight guiding principles? Why eight, not 10, not six? Why?
We have four sets.
Hmm? Why not six?
ये हम चार कॉन्सेप्ट पे बात कर रहे हैं.
Body have four dimensions only. Body have four dimensions only. Like internal, external is one. As per pathology, we can feel only heat and cold. There is nothing other than we can feel by the skin and nose and breathe. We can feel only temperature. It is second dimension. Third is deficiency and excess. It is subject to feel inside our body. We feel it inside our body, not outside. Last one is yin and yang. It is not the subject of feeling, it is the subject of understanding what is going on in our body. So there are yin yang works here, and exterior interior works on our symptoms. Hot and cold are the feelings we feel, and deficiency excess are the type of energy we can feel and we can see also. So there are four dimensions. That's why it will become eight guiding principles, not 10, not six. Okay, what is it? This is a tool. For what? This tool is work in the help of diagnosis. So fluid, the subject of fluid is completed. Today I am starting the eight guiding principle. Okay. From today we will go with the eight guiding principle. I think it will take only one and two sessions to be complete. It is a tool. If you are a mechanic, then it is your tool to diagnose. Okay. And we have to understand what is eight guiding principle. This is the foundation of patterns diagnosis, not the disease diagnosis. Disease are different thing and patterns are different thing. How can anyone say any example of disease and patterns are different? How?
एक तो कभी
Anyone
बाहर
can?
से चोट लगती है और कभी अंदर की फीलिंग अलग होती है,
These
बाहर का
these
अलग होता
these these are the eight part of eight guiding principle. I'm just asking about what is the difference between diagnosis pattern diagnosis, a pattern and a disease. What the difference between a pattern and a disease? What is the major difference in between them?
पैटर्न में आप देखते हो कि लाइक बॉडी किस तरह से बिहेव कर रही है.
Hmm?
तो आपका आपका टेम्परेचर क्या चल रहा है, आपके
Hmm.
की कैसे मूव कर रही है,
Hmm.
या फिर कहीं स्टैग्नेशन है या
Hmm.
स्टैसिस है. दीज आर द
Hmm.
पैटर्न्स. विंड फ्लो
Hmm.
कैसे हो रहा है. एंड
Hmm.
डिजीज में आप एक नाम दे देते हो चीज, कोई भी एक जो सिम्टम, एक कलेक्टिव पैटर्न को आपने एक
Hmm.
नाम दे दिया, दैट इज
Hmm.
डिजीज.
Good. This is the right. Pattern means designed by the TCM, like wind cold attack, key stagnation, key sinking, collapse, humid heat, fluid accumulation, whether misting with the mind. These all are the patterns of the organs to understand, to diagnose and treat. But what is a disease? Disease is the name of sim group of a symptom which is designed by the modern medicine. Like diabetes. What is diabetes? Diabetes is a group of the symptoms: frequent urination and irregular
है.
irregular blood sugar in our streams, and thirst in the night, and gut health issues also comes with diabetes. There are the group of the symptoms. In the constipation, what we feel? Bloating, bargorgasm, hard stool, sometimes bleed, sometimes piles. These all are the symptoms. This is not pattern. Patterns are work in TCM and disease and disorders and syndrome. These three things are uh, invented by modern medicine. So there is in the TCM there is no disorder, disease, and syndrome. Okay, these all things are present in the modern medicine only. If you want to understand the pattern diagnosis, you have to learn eight guiding principle. Okay, the eight guiding principle are the fundamental diagnostic framework in traditional Chinese medicine (TCM) used to understand the nature and location. Mark my word. To understand the nature of a disease and symptoms and location where it's located and the strength of the disease pattern. What I write here? Disease pattern, not a disease. What are the disease pattern? Disease pattern are like wind, heat, and dryness and humid heat. These all are the patterns in the TCM which affect our organs. I'm repeating it again. In the TCM, to understand the nature and location and strength. What is the strength? What is the meaning of strength here? As I say, there are four dimensions in our body. We can feel here one thing, deficiency and excess. In the excess, we feel very hypertensive nature. We become very hyperactive. We do all the things very fast. We are not able to sit properly and calm. We just run here and there, doing something, and after 5 minutes, we are doing another thing, and after 5 minutes, we are doing another thing. We are not able to focus on a subject at a time. Okay, this is excess condition. And there is a deficiency condition also. In the deficiency, you feel dull, no energy, fatigue. Okay, so this is the strength of the disease. What is the strength? Deficiency can be strength and can be strength excess also. Okay, it's help you to diagnose. Okay, point number one, what I mentioned is here.
Yes.
They help practitioners. Okay, they help practitioners organize system into clear diagnostic category. Example, let's take example. Mm, If I wake up in the morning and I feel breathlessness and pain in my body, sometimes this shoulder, and have stomach ache also, and foggy mind. So, what is this are indicating? These symptoms. These are saying there is key stagnation because when the key get stagnated, it start pain. But when key start pain, it's differ from place to place. Like sometimes this side, sometimes this side. It's
Oh,
make your mind very puzzled. You're not able to think clearly when your key get stagnated, and you feel very congested and tight internally in the muscle where the energy get stagnated, and it's become pain, acute pain, not chronic. Chronic pain is dull, acute pain is severe. So they help practitioner organize symptom. When patients say you the symptom, I'm feeling that, and after that, and after that, when I eat something in the lunch, then I feel that, and when I go to bed, I feel that. These all the symptoms get collected by a practitioner and form a pattern. Which form? It can be kidney yang, it can be heart key deficiency, It can be liver yang rises, it can be anything. But the purpose is they help practitioner organize symptoms into clear diagnostic category. Which category and which organs category? You have to decide which organ and which category. Okay. Point number two. What is the core idea? What is the core? Every disease, I'm here now. Okay. Every disease pattern can be understood through four diagnosis pairs. There are eight guiding principles, and both are in a pair. So there are four diagnosis pair. Patient come with yin type of disease or yang type of disease. Sometimes both. It can be both. But in generally, when you diagnose, you will find that there is something happen with the yin and something disturbance with the yang. Okay. This is the yin and yang. First two guiding, which guide you. In the which term you have to ask the next question. Patient come and say, I feel very cold all the day. Then you have the idea, oh, it can be yin excess or yang deficient. Patient is feeling too cold. Now you have the idea which question should he ask next? They will give you the idea to frame a pattern to diagnose a frame a disease patterns. Okay. Second is interior and exterior. Interior and exterior. What is interior and exterior? This is nothing just a internal and external. Internal means anything disturbing internal your body, like acidity. Is an internal disease or a external effect of environment and anything? What you feel about it?
Internal.
It is internal because your stomach has more heat. Okay. But what about the wind when you see there was so too cold environment outside and you go to the shop for shopping and after coming back you feel cough and cold and practitioner says it is cold wind attack. Then what is this? It is internal or external?
External.
It is external because this time you affected by an external environment, external factor, not internal factor. Okay. Okay. How? Okay. Cold and heat. There are two more things to understand: cold and heat. Sometimes patient come and you touch the patient, you see that the patient hand is very cold. There is a summer time of summer in the months of summer. There is no too cold outside and there is no AC. We are sitting in a normal fan, but patient hand is very cold. You touch both hand and you see the patient is very cold. Now you have a category. Now where to go? This type is cold type of pattern. You have a direction. It's give you direction. Yin yang gives you direction of yin and yang, which have disharmony. Internal external give you idea what affect the person and external environment or a internal imbalance. Okay. After that, you have one more idea: cold and heat. Patient is cold, patient is heated. Sometimes patient sweat 24/7 from the forehead, even sitting in the AC room also. So the patient have excess heat in the body. Body try to expel out the heat. When body expel out the heat, body try to heat expel with the sometime blood, sometime with the steam. Make the body fluid as steam and make the to go out from the body. So it show you there is a which type of patient is come to you. It is cold or heat type of patient. There is last one pair, deficiency and excess. You can say by the seeing. not just by asking. You have not to ask. You just say the see the if patient you ask the patient, okay, come to and sit in front of me. If patient come very slowly, coming very no, there is no movement in the body, very dull, and sitting you in front of you like a oh, I am very tired. I have suffered the disease from the last 10 years. I have this
Deficient.
operation 20 years ago. I have this problem. I have this problem. And voice is weak, not able to speak loudly. When a
Def-
person, this is a deficient type of person. When excess type of person come, will come in a different way. If you ask, he will just run in front of you and sit. Sometimes they sit without asking. They just come and sit. Yes, I'm waiting for that, and I'm come from this place, and I have this issue and this issue. And before you're asking, tell me your problem, he start itself saying, I'm come from there, and I have this problem, this problem, this problem, this problem, this problem, and you are just listening. Okay, and he's asking so rapidly, not taking any break, asking one by one, one by one, one by one. This symptom, I have uh, pain in my leg, then I have go to a surgery, and it will not work for me. Then I have a butt issue. I have a lower back ache. Then I have the cervical issue, and after cervical issue, I will take medicine. After that, I will go for the neurologist. He say you have the nerve compression, and that is the so excess conditions patient never take a break. They are always in a hyperactive condition. Always. When the body goes into the excess condition, they are not able to take rest and calm down themselves.
सबसे इजी डायग्नोस.
Yes. It is the easiest diagnose tool to understand the patient. It is deficient or excess. Okay. Come to this portion, clinical meaning. By analyzing these principles, okay, practitioners, we all are practitioners. After analyzing these principles, practitioners identify the nature of disease and determine the appropriate treatment strategy in acupuncture and acupressure also. I mention for both, okay, for acupuncture therapist and acupressure therapist also. If you are able to diagnose, then you can treat in a right direction. If you don't have the proper diagnosis, then there is no cure for any disease. You can give a symptomatic relief by putting some point and needles and magnet and seed, but there will be no cure if you are not able to understand and diagnose which pattern the patient come with. Suppose that patient come with the spleen yang and you think it is the kidney yang. You are putting kidney yang treatment and it's not working on the patient. You have to diagnose which organs yang is get depleted. So clinical meaning of eight guiding principle is just identify the nature of disease. Just identify the nature and determine strategy. What is the strategy? Strategy means suppose that there is a time in the body, okay, and also weakness, and you can say spleen key deficiency. So first of all, you have to remove the damp excess condition. You have to treat first of all excess condition. Remove all the wastage from the body, make body pure. Then nourish the organs and tone the energy. First, you have to be make a strategy. It is a strategy. So eight guiding principle help you to create a strategy, understand the patterns, and understand the treatment also. So
वो डैम
when
कैसे मालूम
hmm, hmm,
डैम कैसे मालूम पड़ेगा?
patient will tell you, patient will tell you if patient says that I eat very less, but I have a big tummy and there is lot of fat in the thighs, okay, and patient says I feel all the time heaviness. There is too much stool every time when I go to for uh, stool, passing the stool. And you see, there is a yellow, light yellow shade in the sweat of the patient. These all will show you heat or damp, sometimes damp heat, sometimes humid heat. Okay. Damp lead to infection sometimes. Like UTI, we treat in TCM as a humid heat in urinary bladder. Okay. And humid damp, when the infection gets severe and creating pus, creating some time, subtype of structure inside the UV. It is called damp. Unnecessary structure, unnecessary size, unnecessary bulking the organs. It's all about dampness. Dampness means anything come in a way and stop in the path and start collecting, accumulating unnecessary thing which is not needed for the body. Okay, this is called damp.
ऑर्गन
Hmm.
ऑर्गन एनलार्ज हो जाता है या वो छोटा हो जाता है?
Yes, yes. Unnecessary growth around the organs. Cyst, tumor, nodes.
ब्लॉकेज भी
When hmm,
ब्लॉकेज भी इसी का ही होगा, ब्लॉकेज।
blockage can be, yes, you can sometime phlegm accumulate in the arteries, sometime damp accumulate in the arteries, and these lead to blockage. When some when symptoms appear complex, you are not able to diagnose. Patient saying, in the daytime I feel so hot, in the night I am feeling so cold. Now, what to do? He is excess in the condition because he's seeing so much means it is excess. And saying in the day I feel so hot, in the night I am feel so cold. So which type of the patient is you get puzzled? It is very difficult to understand what is the root cause of the pattern. It is yang or it is yin. Both are excess in the condition. So you have to go with external and internal. These will help you. And hot and cold, maybe this can help you. And you have to diagnose and ask something which make you it is yin or it is yang excess in the body. Which one is more dominated in the patient's body? So aid guiding principle helps you there when you have the complex pattern in the body. So when symptoms appear complex, patient says, I feel so much hungry, but when I eat, I just vomit everything. Now, what is this? Patient is healthy. That's why he feel hunger. And what about the stool, constipation, loose motion? Everything is fine. I digest the food when I eat. But sometimes when I eat and something, I just vomit out and still I again feel hungry.
एलर्जी।
Hungry. It can be sometime allergy, but it can be some type of pattern as per TCM,
कॉन्ट्रैक्शन।
like contraction of the rebellious key of
स्टमक
stomach,
की।
stagnation of, or it can be liver attacking on the stomach also. Sometimes these symptoms come in the when liver attacks, excess condition of liver attacks only on the weak organs. So liver attack stomach, then this type of symptoms come. So everyone now has a idea of what is aid guiding principle and why we use. So if you have any question about this picture, these three things, these 3 points, then you can ask me, or I can go to my next picture. If you have any question, anyone can ask.
नहीं, ये सब तो पता लगा, लेकिन कहाँ होगा ये सब? ऑर्गन
ये
कौन सा
सब
होगा उसमें?
ये आपने पूछा ना, ऑर्गन कौन सा होगा, ये आपको डायग्नोस
हाँ।
करना है। यही तो आपको सीखना है। आपको जो सीखना है वो यही है। दिस इज द थिंग यू हैव टू लर्न, which organ is going to disturb. This is the most important thing. Patient will never understand that he had a liver wound or heart fire. This is your duty to identify which pattern has the body following for these
हार्ट अटैक
symptoms.
आने के पहले मिल जाते तो?
Sometimes you have the idea of heart attack. Actually, good therapists always have. When they see the patient, they all ask, you will sooner get a heart attack or heart disease. Just because of listening to them after seeing and after asking some few questions. When you have learned the tongue diagnosis, you will get an idea of heart in the first one kun of the tongue. This is my tongue, and first one kun, thumb area, is showing your heart and lungs condition. If there is purple color, dots of very, very very red, dark red colored dots, and you can see blue color also. If stagnation is there, that's mean blue color. If you see this, then you have to go to treat heart immediately of the patient. Otherwise, it can lead to a minor heart attack.
मैं वही तो बोल रही हूँ कि मुझे हार्ट अटैक आने के पहले आप क्यों नहीं मिले?
Oh, so sorry, ma'am. Because at that time I was in my high
हाँ,
school time.
ठीक
I
में
was in
हो
my
अभी।
school. I was doing my high school, so I was not able to diagnose you at that time. Okay. The structure of eight guiding principle. Now you have to learn this thing. I want you to learn that there are eight steps. Okay. Yang category, yin category. Patient come with the yang problem, yang type of symptoms, or come with yin types of symptoms. It's very patient to patient, but you have to ask, see, and check with the touch. When patients say, I feel too hot, too cold, you have to check the patient. Where the disease located. If patients asking you that, I have severe pain in my neck region and stabbing pain, like something is stabbing in my neck. You have to check the temperature also by your hand, and always check the temperature by this part, yang side of the palm. Okay. You have to check this is the heat and so. Okay. Ga, oh sorry, ba gang. Bagang means eight guiding. Ba means eight, gang means guide. Eight guide the cover diagnostic framework. This is the framework. This will help you sometimes, not every time. The eight guiding principle organize all symptoms pattern in traditional Chinese medicine into four diagnostics pair. Okay? They all have pair like which pair? Yin and yin paired with yang. We have two. Okay. After that, deficiency and excess. Excess. We have four. One, two, three, four. Okay. And another pair are external. Suppose patient come with a external and internal. Okay. And it can be cold type of disease also, or heat, or you can say hot type of disease also. Okay. Now what we have 1, 2, 3, 4. 4 plus 4 is equal to 8. These 8 are called 8 guiding principle. They guide you to diagnose and frame a pattern as per TCM. These principles help practitioner understand the nature and location and strength of disease, as I mentioned in my last.
Hmm.
Yang pattern usually represent active, strong, and external condition. Suppose that someone come to you and say, I feel problem in the daytime only. I feel very thirsty. I feel so hot. I sweats a lot. I was not able to sit in a place with patients. My mind always wondering. These all things are come in a yang category. With the yang, it can be exterior. How? If person come to you and say, I feel so much itching here, 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 and you see all over the body part, there is a red color circle, gases. You know, red color circle, gases. Red means hot, okay? And skin is the outer layer of our body. So it is exterior, not interior. So this is a pattern of yang and exterior. You have to understand the pattern, diagnosis. This is a yang type of disease. You have to work on the yang. What is the next level? Next level is patient come with the exterior kind of symptoms. Patient complains that I have itching. When I itch anywhere, skin goes to red color, and after that it start burning. It's get
Changing up.
very tiny pimple on my skins, and after that it will become black after 2 week, 3 week. So these all things are yang and exterior. It can be heat also. Patient can say you, I feel my body is burning all the time and itching all the time. If patient say to you, then what you have to ask in the day and in the night. In the daytime, in the day it is severe. Night is not so much severe. It's happened, but not irritating me so much. But at the time of the day, it's make me very irritated. All the time I just itching myself here and there and there and there. And I feel so much heat, like there is too much heat in the room. All other persons are saying the atmosphere is normal, not so hot, not so cold. But I feel so hot. Like around myself, there is lots of gases are burning, fire is everywhere, and I have the itching issue. So daytime, yang, itching, external, asking, I feel hot, like someone burning. It's a heat condition, not like to go to the exposure of sunlight. Sometimes people ask, I get very minor allergies when I go to in the exposure of sunlight. I feel dizziness when I expend at 30 minute, only 30-minute exposure of the sunlight. So I feared of so much fear of as a spotlight of the sun. So it is the diagnosis. You have a three things. Okay. From four pair in the eight guiding principle, from four pair, you have three things. One thing is even still to find out. It is young, okay. It is exterior, okay. And it is heat, okay. Patient come with these three only. It can be possible. Come with three only. Not there is other thing to diagnose. But sometime, not in the every case, but sometime patient will say you, this was not severe 6 months ago, but from 15 days, it's too much. It's aggravated. I'm changing my place and this aggravate 2 times. That's mean this is a excess condition, not going to downward. It is going to upward. It is leveling up. So what you have to diagnose that this is a young exterior heat and excess. So what you have to treat? You have to treat young exterior heat and excess. What you have not to treat? Cold, yin, deficiency, and interior. You have an idea of a pattern. From eight guiding principles, you will slowly, you will have a language of TCM diagnosis. Okay. You not have to treat the cold of this kind of the patient. If patient come with these complaints, don't go to the yin, don't go to the cold, don't go to the night, don't go to the internal parts and internal things, and don't go to the deficiency. You have to treat one by one. So what will you have to do here? First of all, you have to make this access condition fix. I always ask, always in every session ask, first treat the access condition, remove the access condition. Suppose that there was too much heat and you start treating, access condition goes out, then what will here? There will be three things to treat. Which three things? Yang, exterior, and heat. Access is treated by you. Okay. Now you are still reducing the heat from the patient's body. Now, after 15 days, heat is also treated. Okay. Now, you have two things only to treat, which are yang and exterior. So, you are treating exterior, means you have to treat the lungs. Suppose that it is just an example, not a principle. Okay. I am taking the example of lungs to make you understand as an example. This is not a principle, it is an example. Suppose you treat the lungs. So exterior problem gone. Now what is remain is yang of the body. So you treat the yang. For treating the yang, you have to diagnose which organ is. Suppose that heart, suppose that lung, suppose that liver. Okay. You have to treat yang. When you treat yang, patient have no complaints and asking that I am feeling better and good for now. So this is
और
clear.
सर जब वो 15 दिन का ट्रीटमेंट करेंगे तो
Hmm.
उसी में ही फर्क पड़ जाएगा, पहले हीट जब रिमूव करेंगे तो?
होता क्या है? See, this is the pattern of a disease patient come with. Okay, there is an access condition. I always ask treat access first. When you treat access, the access will uh, go out from the body. There will be a enough amount of this pattern, not excess. Okay. Now you have to treat the heat. Okay. If you treat the heat, there will be only two things: yang disharmony and exterior symptoms. When you treat lungs, exterior symptom gone. When exterior things are gone, you have to work only on yang disharmony. When you treat yang, how and when I will teach in my future sessions. You make the patient's problem free.
सर
Okay.
यही चीज अगर रात में होगी तो?
What?
यही चीज अगर रात में होगी, जैसे आप दिन में बोल रहे हो इचिंग हो जा, और
If
यही
this
रात रात
if this thing happen in the night, see, everyone, please focus that. If this is happening in the night, then exterior is still okay. It is itching is a exterior condition. Focus on that. And there is a heat also. Okay. And there is a deficiency. It can be deficiency also. And if this happen in night, it is the problem of yin. See here.
मतलब ऑर्गन?
Yes. If this come in the night, in the day it is not so severe, that means it is a yin problem. Yin energy get disharmonized. See,
लंग्स में, लंग्स होंगे ना?
it can be lung. I just take example. It patient come with a lots of symptoms. There are lots of patient in the world. There will they will come with
जो मैक्सिमम होता है वो तो बता दो।
hmm?
मैक्सिमम जो होता है वो तो बता दो।
Maximum, there is no maximum, there is no minimum. If you are a therapist, you want to treat a patient, never think about diabetes patient are in the excess amount, they will come to me always. No, any kind of person, any kind of disease carried, come to you. You have to handle all types of disease. You have a full knowledge of TCM. Okay. So I make this one clear to everyone. There is any question about that? No? Okay, I'm going to second one, and second one is not taking as so much time as take this. Okay. Now, come to here. Okay, patient says problem in the daytime and problem in the skin and feeling heat, but not saying it is excess. Saying I feel too much of fatigue, laziness, dullness all the time, no energy in my body. So it is excess or deficient? It is
Deficient.
deficient. So you have to treat what? You have to treat first of all
Deficiency.
deficiency. I am just taking example. Okay. Then remove the heat, then treat the lungs, and then treat the yang. This will be your step of line of treatment. And these things help you. This is a tool. I always call that. I always say to everyone, eight guiding principle is a tool to diagnose. See, there are
Okay.
four pair, okay? And from
Mm.
one come in every pattern. Yin or yang, yang is there. Internal, external, external is there. Heat and cold, heat is there. Excess and deficiency, deficiency is there. There four things are in a pattern. It can be yin type, it can be interior just opposite, it can be cold just opposite, it can be deficiency just opposite. Four things you have to diagnose always. Okay,
तो हमेशा
our
हीट
body
को
have hmm,
हम्म, तो हमेशा हीट को रिमूव करने के लिए हम लोग को किडनी का ही पॉइंट लेना पड़ेगा ना?
no, it is not about the kidney and any organ. It is about
तो
your
फिर
diagnosis. When you diagnose the heat is come from the liver, then sedate the liver seat. If you have idea, the heat comes from the stomach. It is stomach heat. Then you have to treat the heat of stomach.
36.
If the heat comes from the LI, then you have to treat the LI heat. So this is your duty. This is your work. This is your skills, and you have to work on these things to find out, like an investigator, like a detective. Be a detective. Go to into the body of a patient and find out the pattern, like a detective. Okay, and always focus on four things. And these four things are in the pair. Okay? Patient can come with yin category type. Yin, in the yin, patient will come and say, I feel so thirsty in the night and excess urination in the night, not in the daytime. Okay, patient is complaining about the issue, but in the night. Daytime, he is saying things not trouble me, troubles and bother me in the night. Okay, that means this is a yin type of disease. Okay, patient says, I feel so much dryness. Because of dryness, I feel so much irritation. It's made me so irritated, and my lips are start cracking, heels are cracking. You have an idea. Oh, okay, this is an external complaint, not internal. And this is there is heat because patient complain. I feel so much thirst, and things are goes dry like lips and heels. That means there is heat somewhere in the body. And patient also asked me that, says, told me that when I wake up in the morning, I don't feel too much energy in my body. I feel dullness in the morning. When I wake up, I have no freshness in the morning. That means there is a deficiency. So treat one by one, tone the deficiency, remove the heat. When, as per my opinion, first of all, treat the heat, not the deficiency. Okay? As per my opinion, treat the heat first. Remove the heat. Okay? Heat is gone. Then you have to treat the exterior portion, means lung. Okay? Exterior portion is gone. Then you have to diagnose which organ is involved in this pattern. Then you have to tone the element and the organ of the patient. Then the deficiency will get cured. And you have to make yin in harmony. So you have lastly treat the yin. Okay. Yin pattern represent deeper, colder, or deficient condition in the body. I am showing you one more example. Come to here and recite yin condition. Patient complained you, I feel so much cold in the night. Too cold. That means there is an excess of yin. It can be possible or not. Excess of cold feeling can be happen by the excess of yin or not. It can be. And he is saying, I feel so much urge of urination. This is not an external problem. It is the
Internal.
internal issue. Okay. Again. And he's complaining about the coldness. He feels too much cold. Okay? And he's saying, when I was in my team, I played well. From 2 months, I'm not able to play football with my team. From 2 months, that means there is loss of energy. It is a deficiency kind of issue. So, what you have to teach, first of all, access condition, as per my opinion. It is my observation, my interpretation. Okay. So, you have to treat, first of all, access. What is access? Cold. Remove the cold from the patient's body. After that, treat the internal organ. Which organ is involved? Maybe kidney UV. Okay. Treat them. And when you treat the kidney and UV, you have parallelly treat the deficiency also. It's up to you. Use 2 points, 3 points, single point, magnet, needle, anything you want. Okay? And at the last, you have to make yin in a harmony. Okay. When you treat yin, all the four things are get treated by you. This is the power of eight guiding principle. Any question about this eight guiding principle?
Sir,
Anyone?
I didn't understand this principle, sir, frankly.
You come on the time when I
No,
started?
sir, by 10 minutes I had late, but by
Yes,
the time I
yes.
am trying to understand that, but I didn't get the link anywhere.
Because you joined the late, because I say something in early when I start the session. Okay. What
Will you
is
please,
bothering? What is you are not able to understand in the this content?
no, sir, will you
Okay.
please show me that first slide, sir? From the
Wait a
beginning,
minute.
I didn't get, sir.
Wait a minute. Wait a minute. Please, give me just a minute.
और मुझे एक बात समझ में आई है।
Wait. I'm feeling a technical issue in my laptop.
Ma'am, if you don't mind, will you please precise it? Sir has some technical issues.
Okay. Now problem is resolved. Okay.
हाँ तो
Okay.
सर मुझे
What are you seeing in my screen?
हाँ ये
What are you seeing?
एक्सटीन हाँ ये इन
Okay.
कैटेगरी या कैटेगरी एक्सटीन
Okay.
चला गया।
Okay. I know. Okay. Okay. Ma'am, Sunitha ma'am, what is not you able to understand in this concept? Ask me.
Sir, what are the basic 8 principle guides, sir? What are
Basic.
the principles?
If you need to understand basic, I have to repeat the first slide.
That's what I am asking. First slide. Purpose And the second one is K.
So this is the thing I always mention in the announcement of the session. Please join at the time because it's take 2 or 3 times energy and time to explain the things. Mm.
No, so you can precise it, I can understand, but I didn't get the
Yes,
idea
yes.
from the beginning. That's why I didn't get.
Mm. Actually, in the TCM, there is a tool. They create a tool and they call them 8 guiding principle. Why 8? Not 6, not 10, not 5, not 15. Why 8? Hmm? Anyone have any idea? Because body have 4 kind of dimension as per polarity, like yin and yang, like yin and yang. As per TCM, we have 2 kind of polarity of key in the bodies, yin and yang. This one is the first pair of 8 guiding principle. What is the 8 guiding principle? What is? What is the 8 guiding principle? Okay. And this is why we use, no. Why do we use, no, not why, not how. Okay, come to now. What are the 8 guiding principles? There is no 6, there is no 7, there is 8 because body have 4 times of dimension as per the polarity of energy. First is yin and yang, Sunita ma'am. There is
Yes,
two
sir.
types of
Yes, sir.
energy in our
Yeah,
body.
yeah, you know, dang, I
When
can
a
understand.
patient come to you, he will come with 2 kind of disturbance. It can be yin, it can be yang. There is any third thing? No.
No.
Okay. And patient can complain one more thing to you. Patient will come and can ask you, I have rashes in my skin. I have itching all the time on my hands. I have all the time sweating in my palms. It can be an exterior problem or can complain you that uh, I have acidity or indigestion. Indigestion and acidity is an internal problem or external problem?
Internals.
Internal. And itching is an external problem or internal problem?
This is related to skin, it's a external.
Skin is external and stomach
External.
external. So body
Internal.
has one okay, body has one more polarity, which is external and internal. One thing is internal. It can be a patient come to you with the complaints of internal disharmony and come to you with the symptoms of external type of disease. It can be possible or not? Hmm?
Yes, sir. You are catering now, up to now, we are catering into 4 categories.
Yes.
In and
Yes.
yang and exterior and interior.
Yes. And this will help you to diagnose. Actually, you are not going to the phase of diagnose. You are diagnosing. It is external or it is internal. Which type of polarity is affected in the body of the patient? Okay. Patient
Okay.
patient can say you, I feel so much cold, or can say, I feel all the time so much heat. I don't like the sun exposure of sun. When I go to the exposure of sun, after 30 minutes, I feel some dizziness, vertigo, and I have the rashes and pimples in my face, not faces. Everyone is not a Ravan. Uh, so it can be possible or not, Sunita ma'am?
Yes, sir.
It can be possible or not. Patient come with cold types of symptoms and heat type of symptoms. It can be possible or not?
It can.
It can.
Yes.
Some will says, I feel so cold.
They will
I
come that symptoms are, they will tell the symptoms. We have to identify that is the which one they are. We
this
have
is
to
the
segregate
this
it.
is the this is the third polarity of dimension is temperature. And you also have to check. Suppose that if I say I have cervical issue and I feel here severe pain, stubbing kind of pains, just like something stubbing here, and I feel so much in my trapezius muscle. My trapezius muscle is like tearing and come out, so much pain. Then you have to put your hand to the local area of the
Pain.
patient's problem where he complaining about the pain. You have to see this is hot, cold. Sometimes you feel this is cold. Sometimes you will feel this is hot. There is one more dimension, which is temperature in the body. Person to person, it's different. And in the disease to disease, it's differ. Sometimes cold kind of disease, sometimes heat kind of disease. Okay, like suppose that if outside there is too much cold and you go for a walk, and after coming walk you feel some sinus issues, some cough and cold. This is external and this is internal. Sunita ma'am,
Temperature is external, sir.
external. This come from the external environment. Okay,
Yes. Yes.
and this is cold or hot type of disease.
Which one is? If it is a hot conditions, it is the hot condition.
No,
If it is
no.
the temperature is
Patient says you it is too much cold outside and I go just for a simple walk. When I come back to my home, I feel some sinus and cold and cough. So this is
cold,
cold
cold,
or
sir.
cold,
Cold,
cold
cold.
kind of disease. Okay.
Okay.
And there is one more polarity in the body. This is depend on like strength of the disease. It always show the strength of the disease. It is deficiency and excess.
Excess.
If someone says you when I go to pass out my stool, when I pass out my stool and come out from my bathroom, I feel so much dizziness. I feel so much dullness. I feel fatigue. So it is access condition or deficient?
Deficiency.
Deficiency. Deficiency. If a patient come to you for a treatment and asking you, when I eat anything, I feel so much hyperactive. I'm too hyper. I'm taking the medicine of hypertension. But when I eat anything, my BP again go shoot upward. So it is excess or deficient?
Excess.
Hmm?
Excess.
Excess. So body has one more polarity. It is deficiency and excess. So body has four kind of polarity. One first is Piyush, mute yourself. There's too much voice coming from I don't know from where. We have four kind of polarity. First is energy level. You have to diagnose. This is yin or yang level of disease. Second polarity, yin and yang is the energy level dimension of body. Second dimension in polarity is external and internal. There can be disease of hair fall. It is an external kind of disease, but it can be internal kind of disease also, like spleen key weakness. If spleen get weak, it is not able to hold anything in the body, so hair fall starts. It can be interior also,
Interior.
exterior
Internal.
also. So body has one more polarity. What? Please.
Thus, if the spleen is weak, it is the internal. Sir.
Yes, it is internal, but it can be it can be external also. Like I say, uh, mention wind attack. Person goes for a simple walk in a winter and get a cough and cold. It is a wind cold attack. Wind cold invasion means wind with coldness come to your lungs and affect your immunity, and now you have cough and cold sinus issues. There can be cold and heat, and there can be excess and deficiency. I explain this very well. Before explaining this, I explain one, two, and three. These 3 points also. It's up to you. If you are serious, you have to come to join on the time. Otherwise, it will see you. Otherwise, it will be your waste of time. not me, mine. You have to come on the time because I take 15 to 16 minutes to this image to explain every angle what is eight guiding principle. Okay. And Anju ma'am and Manjeet ma'am have the complete idea of what is eight guiding principle. If you want to see, let me show. Anju ma'am, please summarize what is eight guiding principle.
Okay, so eight guiding principles. These are based on the pair of uh, four things like internal, external, yin and yang, internal, external, hot and cold, deficiency and excess. Because of these, we can understand the pattern, what kind of pattern the person is showing. And on the basis of these eight guiding principles, we can reach up to the organ affected, and we can give them the pattern like whether it is wind cold attack or wind heat attack or humid heat like this. And this like and each pair is having its own characteristic, just like we have the four dimensions of the body, we have the four pairs, we have four set of pairs. Anything else should I be saying?
No, it is enough. So man has the complete idea. From where? From me. There is no another source to know that eight guiding principle. So you have to be little sincere. Okay. For
तो
you.
सर सुनो सर
Yes.
सर मेरे को ऐसा लगता है कि अगर रात में कुछ भी प्रॉब्लम होती है तो यिन के प्रॉब्लम होते हैं और दिन में जो होते हैं वो यांग के, ऐसा सही है?
ऐसा जरूरी नहीं है, ऐसा जरूरी नहीं है, बट मोस्ट ऑफ द टाइम आपको ये मिलेगा पैटर्न, क्योंकि जीन का मतलब है रात. तो मोस्ट ऑफ द टाइम यू विल गेट this kind of patterns. So, Sunita ma'am, for you, I am again going to explain this picture again. Okay. The eight guiding principles are the fundamental diagnosis framework. What is framework? Framework means making symptoms in a pattern. There are 12 organs in our TCM, you know, 12 organs in our TCM. We treat
Sorry to
everything.
interrupt, but if you have already discussed this, then maybe Sunita ma'am can go through the recording, and if she has any question, she can ask in the next session, or she can message you personally, because you have
Okay.
more topics to cover.
Hmm. I just summarizing. I just try to
Okay.
summarize this, and after that I will stop this session today for you. So this is a framework. In this framework, you have to use your eight guiding principle, which is yin and yang, and interior, exterior, cold and heat, deficiency and excess. Only these four pair you have to diagnose to get a pattern. If you are able to diagnose these four things, you are definitely get an idea of pattern. Okay. Understand the nature, location, and strength. Understand the nature. Nature is yin yang. Location is internal, external. Strength is cold, heat, and excess deficiency. These four things are strength of a disease. I'm just going very fast. They help practitioners, not patient. They help only for practitioners. Patient never get benefit by eight guiding principles. They help practitioners organize symptom into clear diagnosis categories. If you have the idea, every disease pattern can be understood through four diagnosis pair. These are the four pair. Okay. And clinical meaning is by analyzing these principles, practitioners, I again mention that, you know, type every word. You know, here I mention acupuncture and acupressure both. I type every word manually, then I create this image by AI. So I planned everything and I have a insight between every word. If you are able, you can get it. By analyzing these principles, practitioners identify the nature of disease. This is yin type, yang type. This is interior, exterior. This is cold disease. This is hot disease. This is deficiency and this is excess. If you are get correct diagnosis, you can treat patient 100% successfully. If you have the misdiagnosis, you can give the symptomatic relief, but never ever can cure any disease of any patient. Okay. Determine the appropriate treatment strategy. What is the treatment strategy? Now, when you know that, okay, I will tell you after that. Treatment strategy in acupuncture and acupressure both. When symptoms appear complex, the eight guiding principle simplify, diagnose, and guide the treatment. What is the meaning of complex? Complex means a patient come to you and say, I feel so much hot in the daytime, I feel so much cold in the night time. Now, what is the meaning of that? Both are present in the body, both are in the excess. Which one is deficient? No idea. Which one is dominating? No idea. This is yang or yin? No idea, because in the both time patient complain. So here you have to go to the external, internal, excess, deficiency, heat and cold, eight guiding principle. They will help you as a tool to diagnose. If you get a correct diagnosis, then your treatment will be successful. Sunita ma'am, have you get some idea of what is
Yes,
eight
sir.
guiding?
Eight guiding principle I can understand.
And here are the some example. You have
Here
to go.
I had understood, sir. Here I have one doubt, sir. Yang category, we have the two yang categories and we have the two yin
Patient
categories.
patient
Yes.
come like that. Like
Okay.
that. I feel so much irritation in the daytime, itching.
Okay.
Where in the
Okay.
skin means exterior kind of disease. When I itch somewhere, it goes red and make a patch, rashes. That's mean there is a heat in the blood and body also. And I feel so much dizziness, so much fatigue, no energy, not able to, not desire to go anywhere, not desire to go for hangout with the friends. That means there's a deficiency. So what you have to treat? First, you have to treat heat, then exterior kind of disease mean lungs. I taking the example lungs as example. This is not a principle. Okay. If there is exterior, treat the lung. If this is interior, then find out the organ. Okay. If you treat everything, deficiency, heat, exterior, then one polarity will remain in the disease is yin and yang. If you see there is yang time disturbance, you have to treat yang. If this is excess, sedate it. If this is deficient, tone it. When the yang get harmonized and yin get harmonized, this is called the health. Yin and yang in a harmony and enough amount and anchoring each other very sincerely and flowing in the meridian very properly. This is your complete health, where the yin and yang get in a balance. But this is achieved by the siddhas and yogis. This is not able to control and achieve this condition by our layman. We are the practitioner, we layman, not able to achieve this kind of state where the yin and yang both are get balanced. Okay. So I'm just stopping subject here. Okay. In the next session, I will complete the eight guiding principle by this and this. After that, I will go to the organ and patterns. Now you are come to the pattern diagnosis. So much goes. You have to be sincere. Who are watching this recording? You also. Now, this is a query time. If you have any query, any doubt, you can ask me.
So when we have a patient in front of us, so we should have a set of questions.
Yes.
Based on that, we can write the what we the patient's complaints we write in the whether it is on the yin category or yang category, and then whether it is excess or deficit, or whether it is cold or hot. We categorize them, and then finally we will make a decision whether it is of which type. Correct.
Correct. 100%.
So
Let
for
me, yang category, we will not get interior problem. No, we can get interior problem in yang category also. Suppose that liver yang gets raised. Who is this? Ravindranath. Ravindra sir, if liver yang get rises, this is internal or external? Sir, if liver yang get rises and creating problem so much. So this is internal or external? This is internal. And this is yang condition or yin condition? This is yang condition. You have to diagnose the pattern. And I will teach you and I will discuss all the methods how to diagnose, like I am discussing about the 8 guiding principle. And 8 guiding principle is must for you to diagnose any kind of pattern as per TCM. Suppose that there is 12 organs. In your slide, you are mentioned both internal, sir. No, I will share you the image. You can see there are internal also and external also. I will show you. See, if you have 12 organs, okay, and each have many kind of pattern: wind, excess heat, dryness, and coldness. Suppose there are 80 patterns. Suppose that. Only suppose. Only suppose. This is not factual truth. Only suppose there are 80 patterns. And now I need the help of Aisha. When I ask you, then answer a question. Okay? 80 patterns. Now, there is a patient come to get a treatment by Aisha. And Aisha has to find out which the problem is there. Okay? Aisha, if someone come to you and say that he has chronic disease, then what is this? Yin and yang?
Yeah.
In. That's mean 40 patterns of yang is not needed here. You have to go only for more 40 patterns which are include yang. Okay? Okay. There is only 40 patterns. Okay. There can be 20 types of internal and there can be 20 types of external. Okay? Okay. Aisa, if patient asks you that there is too much dryness in face and too much dandruff on the head. So it is internal or external?
External.
Okay. You have external. You
Yes.
don't take okay, suppose that if I'm asking a digestive issue, then
Then it is internal.
it's an internal. Okay.
Yeah.
So cross
See,
this.
the external issue is because of the internal problem only, but because it is seen on the
You
surface
go
level,
with
the
you go
skin.
with it. You
Yeah.
go with it now. You have diagnosed first diagnose yin, second you
Hmm.
diagnose it is internal.
Hmm.
I'm writing in. In means internal. Okay.
Okay.
In the internal, 10 pattern will be of cold and 10 pattern will be of hot. If patient say you that I feel so much acidity after eating, it is heat and it is hot. Cold and hot,
Heat.
sorry. Heat
Heat.
and hot. Huh?
It is heat or hot.
It is heat
Both
and
are
not hot.
both are same.
Cold,
It is
both
not
are
cold
same.
syndrome, it is a
Cold,
heat syndrome.
heat
Yeah.
symptoms. So you don't go with the cold. You go with the heat. Now you have 10 patterns to diagnose out of 40. See the magic of 8 guiding principle. how to scroll this. Can anyone please scroll my screen? Okay, I will do by myself. I want to scroll out this thing from my laptop. Now you have only 10 types of pattern out of 80. So tell me now, Ravindra sir, tell me now, it is helpful tool or not? Ravindra sir, hello. A Ravindra sir. Ji. So it is helpful or not if you have 80 pattern in the, suppose that 80 pattern to diagnose for a patient, but 8 guiding principle make it only 10 for you. Only 10 pattern. You have to diagnose by the symptom which one is affected by the organ and element. So now it is helpful for you or not?
Helpful, sir.
Very helpful, sir. Very helpful.
Yes, sir.
You
Very
have-
helpful, sir.
You have eliminated 70 patterns. You
But
have now.
your,
Yes.
sir, that slide it is mentioned both are exterior, sir.
Okay. I'm going again to my slide. Okay. So
Out of 10
everyone,
also, we will see whether it is deficient or
yes,
excess.
yes. When you go for deficient and excess, then you have to work
5,
on
sir.
only
5?
5
Yes,
patterns.
sir.
If patient says acidity, that means this is an excess condition, okay? And
Yes, sir.
you have not go to the deficiency, so cut this 5. Now you have work on the 5 pattern to diagnose. This make your diagnose so easy.
Yes, sir.
Let's see how easy is that. This is so easy. It
Yes,
is.
sir. Yes, sir. Yes, sir.
Yes. Okay, I am
It's-
going to share again my image. Thank you, Aizan. See in the image, there is interior mention in the two,
Both are exterior, sir. Both are heat.
both
In
are.
the end, you had
You,
mentioned both
you see here and here.
Yes, sir.
Both are exterior, okay?
Both are exterior, sir.
Okay. But you have see there,
Inside is both exterior, interior, both are there, sir.
both are there. There can be possibilities. Okay. There can be possibility of yin type of disease patient come with, yang type of disease patient come with, heat type of disease patient come with, cold type of disease patient come with, excess type of disease patient come with, deficient type of disease patient come with. There can be more things than I can explain. It is
Okay, sir.
up to you how to diagnose and how to use the 8 guiding principle. Tomorrow, I will teach you how to diagnose
Okay, sir.
and why we use, as you see in my screen, why we use 8 guiding principle. I will first of all explain that. I already explained today, I think. I will just come here and finish this topic in the next session. Okay.
Okay, sir.
Be sincere, come on the time, watch the recordings, make the notes, and practice to diagnose your family members, your friends, your neighbors. If patient come to you, then use this 8 guiding principle to make the sort out of the patterns, as I mentioned now. अंजू मैम, अभी आपने देखा मैंने 80 पैटर्न्स को कैसे 10 पैटर्न्स पे ला दिया, फिर 5 पैटर्न्स पे आ गया, आपने देखा भी?
नहीं, मैंने थोड़ा मिस किया, मेरा एक
वो
इम्पोर्टेंट
देखना है
कॉल आ
आपको,
गया
मैंने
था,
देखा
मैं
आपको, आप
रिपीट
चली
कर।
गई थी, वो आपको देखना है, ठीक है? वो
हाँ
जरूरी
जी।
है, नेसेसरी पार्ट है वहाँ पे, ठीक?
हाँ।
ऐसा? Any question?
Yes, sir. No, sir.
Okay.
Yeah.
Manjit ma'am, Ranu ma'am, Sunita ma'am, any question? This is a query
सर
time.
मेरे को खुद ही
Sir, I
थेरेपी
didn't think so. I am asking the doubts, and again, it is a repeated for all the purpose. I think all the people. I think I didn't waste the time. I think so. This is
You are
my
not waste of
opinion.
time. It is your.
Someone had mentioned that waste of time. She will go for the videos
listen.
and if I
As
stuck
per,
in the one topic, I have to clear that one, sir. Otherwise,
yes,
I
yes, yes.
didn't get anything.
Listen. As
If I am
per instructor and as per teacher, I have to teach you a lot. I have to teach you many things. If you make the things repeated, it will be take time of the session. If you taking the time of the session, things will be lengthy. Session will be more. If you want to make your concept more clear, work on yourself. Watch the recording, make the note, work alone, and make the noise in the crowd. Okay. Any other person? Any question?
सर मैं अपना बता रही हूँ, खुद ही थेरेपिस्ट, खुद ही पेशेंट.
Okay. Then it is good. Any other person? Any question? Ritu ma'am?
No, sir. You explained very well. Thank you, sir.
Okay. Aisa, any question?
Awesome. Thank you. It was wonderful session.
Okay. 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 I have to stop the recording. Otherwise, people will not go with the recording.